Hey guys, it's Karen Yaboa Normant from Pros for MPs. Today on Highlighting the MP, I have GI nurse practitioner Kate Grasso, who is an adult gero nurse practitioner, and she specializes in gastrointestinal disease. So today we're going to just talk to her about just being a GI nurse practitioner. Thank you, Kate, for joining us today.
Thank you for having me.
I appreciate it. Thank you so much. So let's just get into it. What made you want to become a gastroenterology nurse practitioner?
Well, there was a couple reasons. One is that I felt very comfortable practicing GI through my practice in internal medicine, which was the job I was doing before I took this job. So I used to see a lot of acute cases or sick visits, and a lot of them involved GI issues. So I kind of had to fly by the seat of my pants and learn the GI system and how to treat these patients through internal medicine. So I just felt very comfortable with the GI system. And when this job came up and I decided to make a change from internal medicine, it felt like a really good fit.
Well, that makes sense. So you saw it in internal medicine.
Yes, I would see it several times a day.
Oh, okay. Yeah. So you had the experience in internal medicine, which was like, I should specialize in this, which makes sense.
Right. Yep.
Did you have any training to become a GI nurse practitioner?
So I didn't have any specific training. I kind of learned on the job. One of the unique things that I did have was being that I worked with endocrinology. I was able to learn a lot through the residency program that was being taught with the practice that I worked at. So I was able to get a lot of knowledge from the endocrinologists that I work with. That it also involves, obviously, the GI system and its accessory organs. So I felt that having that knowledge was great. And then as I transitioned from internal medicine into GI, I spent a year doing a big bulk of my CMEs that I needed for recertification in gastroenterology and hepatology. And so I learned a lot waiting to start my new job by doing that.
Gotta love those CMEs. Yeah, they're very helpful.
Yeah, they sure are.
Very helpful. And then what are the common gastrointestinal medical conditions you treat?
So the common GI disorders that I treat and see on a daily basis when I'm working is GERD, is irritable bowel syndrome. I would say those are probably the two most common. But again, I see a whole range of things. There's so many things. It's amazing, the GI tract, being that it's the second largest organ in our body. So I see things from anemia. I'm doing colonoscopy screenings and surveillances. I'm seeing Barrett's esophagus and EOE. Celiac disease, inflammatory bowel disease, hepatitis, NASH, cirrhosis, pancreatic disorders, and then again, a lot of malabsorption and digestive disorders. So there's just a huge array of disorders that I deal with in GI, which keeps it exciting.
And then what are some of the complex conditions you treat?
The complex conditions are inflammatory bowel disease, Crohn's, and ulcerative colitis. We've come such a long way in how we treat those patients, especially with the biologics that are out now. So it has made it a lot easier, but some of them can be, they're just non-responders or they don't do well. They develop antibodies and the medications don't work. And those can be difficult cases as well as liver disease. There's some complex, the liver is very complex, and some of the diseases that go along with it. Obviously, cirrhosis and liver failure, some of the hepatocellular cancers, those things can be very tough.
Got it. And on the side, I see like veterans for disability compensation exams, and a lot of the claims they put in are for GERD and IBS due to Gulf War syndrome. Do you see that cause when you see these patients for GERD and IBS or any veterans?
Yes, we have seen chronic inflammation, a lot of acute gastritis and chronic gastritis with some of our veterans, especially from the Gulf War, in the oil fields specifically, and seen a lot of esophageal cancers with those as well. And stomach. So I do see them in the practice, and it's actually quite sad to see these diseases and cancers that they've developed from being a veteran.
See, I haven't seen a lot of esophageal cancers. I've seen a lot of prostate because that's like with the Agent Orange with Vietnam, but I will keep an eye on that. But it's like the main ones they claim is GERD and IBS all the time
a lot of that. Yeah, for sure. That we've seen a lot of that, and a lot of that it has to do with the psychological component that comes along with PTSD. And so, unfortunately, as we all know, our veterans suffer and have a lot of mental health issues from going on tour. And so when they come home, because of the gut-brain axis, they're having true GI symptoms and feel really lousy. And a lot of it's coming just from the psych component.
Good to know. What does your daily schedule look like as a GI nurse practitioner?
So my daily schedules usually involve seeing anywhere between 14 to 16 or 18 patients. About half of those will be new patients coming in. A lot of it will be colorectal screenings and discussing that with the patient and telling them what a colorectal exam and a colonoscopy or an endoscopy involves. And then a lot of other things are irritable bowel syndrome, chronic constipation or diarrhea, GERD, all those things, hemorrhoids, anemia, all sorts of things. So I'm writing a lot of scripts for medications. I'm writing a lot of scans such as CT or MRIs and abdominal ultrasounds. And I'm also doing a lot of stool studies. That's a big component of my job every day.
And do you work 8 hours? You work 10 hours?
Yeah, I usually work anywhere between 8 to 9 hours for my day by the time I finish up and get home. And I work in an outpatient practice, a large outpatient practice, but I also do go to a few of the subacute nursing homes that are local, that our doctors are contracted with to do GI consults there as well.
Okay, so it's outpatient, so you get like a little change of scenery at these subacute facilities.
Yes.
And then the colorectal screening, is that 45 now?
Yep, the guidelines are 45. They've actually been 45 for a while, but insurance companies have not gotten on board, so they would refuse them when the patients would come in following their primary care, who would advise them at 45 to get screened. But now the insurance companies, starting in June, now will cover colorectal screening starting at age 45.
Okay, so I got like 12 more years.
Yep. Unless you have a family history.
Okay. And then can you recommend any GI conferences and or courses?
So I do a lot of my courses for my CMEs through the AANP, which is where I was certified, and they're free. And they offer quite a bit. So I do a lot of those. But there is a Mayo Clinic. It's actually a board certification for physicians, but it's also available for nurse practitioners and PAs if they want to do it. It's a little bit on the pricier side, but it is preparing you for boards. So it's a wealth of knowledge, and it's so informative, and it's great. And I've done that.
Good to know. So that's the Mayo Clinic, right?
Correct.
And do you know what it's called?
I believe if you were to look up Mayo Clinic and you did gastrointestinal and hepatology board certification, it would come up. It's basically a course that you buy, and it involves studying for the board exam, the state board exam.
Got it. Okay. And do you do any procedures as a GI nurse practitioner?
So I don't do any procedures as a GI nurse practitioner. I do rectal exams, and sometimes I assist with changing tubes, feeding tubes, but that's about as far as it goes.
Okay. And then what advice would you give to the nurse practitioner who is interested in specializing in GI disorders as a nurse practitioner?
So the advice that I would give is when you graduate and become a nurse practitioner, I think having several years experience in internal medicine and primary care will greatly assist you in the role of a GI nurse practitioner. I think coming out of school and taking a job right away in GI is doing a disservice to yourself, because the wealth of knowledge that you're going to get working in internal medicine um, and all the other health systems that you have to deal with in terms of diagnosing, that gives you a lot of experience, especially with diabetes and autoimmune disorders, before taking a job on as a GI. And I'm happy that I was able to do that prior to taking this job.
No, you're right. You want a good solid foundation before you specialize in it. And it makes it easier as you transition from like internal medicine to GI. So thank you.
Definitely.
And
Definitely.
then my last question is, what would you say are the pros and cons of being like a GI nurse practitioner?
So the pros are, you get to work with a bunch of fantastic doctors and other NPs um, in an area that affects everybody. So everybody has GI issues. At some point in their life, somebody's having GI issues. So the pros are it's a great field, and you're constantly learning, and there's always new medications that are coming out to help with our GI disorders. So it's very exciting. It never gets boring. The cons would be if you were to come out and just get a job right away in GI, you'd be missing out on a lot of things that you need to learn about, especially when you're dealing with comorbidities. And in GI, most of your patients have a few comorbidities, and they can be more complex. And so having a good base of knowledge through internal medicine or primary care before coming in with things like diabetes and heart disease and kidney disease will really help you in your practice as a GI nurse practitioner.
Thank you. Thank you for advice. Thank you for the conversation today. So
You're very welcome. Thank you for having me.
yeah, I got to learn a little bit more about GI, and anyone who's interested in GI, I hope this was helpful.
Oh, great. Wonderful. Thank you so much.
Thank you.
Okay. Bye.